Welcome to the HealthChangers podcast, presented by Cambia Health Solutions, where we share real stories of healthcare transformation from those experiencing it and those helping to make healthcare more personalized. I'm your host, Leslie. The coronavirus has altered the lives of people all over the world. Our everyday routines have changed dramatically, and millions of Americans are coping with the loss of their jobs. Families have been shattered by illness or the loss of a loved one, and on the front lines, healthcare workers are bravely battling an unseen enemy. The COVID-19 outbreak has also forced healthcare providers to rapidly change their long-established delivery models in order to tackle this sudden and widespread pandemic. On this episode of HealthChangers, we'll hear from two healthcare innovators who will talk about how they think the coronavirus could impact healthcare over the long run. Rob Coppedge is the CEO of Echo Health Ventures, a strategic investing firm that seeks out and grows tomorrow's great healthcare companies. And Ben Albert is the co-founder of Upfront Health, a company that has created a platform to personalize care navigation to efficiently engage all patients and improve health outcomes. To kick it off, I just wanted to check in with you both, see how you're doing, and ask you how your businesses are addressing this serious public health issue. Ben, do you want to start us off?
Sure. Thank you very much, Leslie. It is a crazy time without question, this pandemic. As we sit today with this pandemic in the United States on 3/31, there's 165,000 reported cases, and that continues to grow rapidly. And us at Upfront Healthcare, we're all focused on how do we help get patients to the services that they need through our digital care traffic control platform. And so for us, when this started to evolve and health systems began responding in such an aggressive way, it aligned directly with what our mission is as a company to really help enable them at scale to get the patients to the services that they needed. So we've been working around the clock, both professionally and obviously all adjusting personally to this new world order to help our clients and health systems meet their mission of getting the care that they need, the patients need, to the patient.
Yeah, Ben, can I ask you, where are you calling in from? I'm assuming you're remote and working from home and staying safe and healthy.
Yes, thank you, Leslie. I'm calling in from Evanston, Illinois, and we are working from home, and I apologize if you hear a dog barking in the background as a result of that, but certainly focused here, and it's not only a national problem, obviously, as everyone knows, it's quite a local one as well.
Thank you. And Rob, where are you today, and how is Echo Health Ventures looking at this critical public health issue?
Sure. Thanks, Leslie. And after spending probably the past 6 months of my life on airplanes, going to meetings all over the place, I'm calling in now from a guest bedroom in our house in Portland, Oregon, trying to find a quiet place away from the kids homeschooling and screaming and yelling. And that's the reality for our whole team and for all of the companies we support as an investor in transformative companies in the healthcare space. You know, we've been investing as Echo in these sort of transformative businesses for the past 3.5 years. And really, this is a good reminder for our team, even as we hunker down and try to do our jobs a little differently, a good reminder of why innovation and transformation is so essential in this healthcare system, makes our work feel a lot more relevant, especially because we've made it our practice not to invest in sort of novelty apps and sort of digital health sort of silliness, but instead focus on those companies that are making a big difference and can make a big difference in today's healthcare system and tomorrow's. And so our team's all hunkered down, and across the country we have folks in Boston, Portland, Seattle, and Durham who are working closely with both Cambia and Blue Cross North Carolina on trying to bring some of these transformative solutions into their business, and also with our portfolio companies on ensuring that their companies stay strong through a period of real transformation and challenge. And, probably no companies doing more right now for the delivery system as they face this challenge than Upfront. So it's really a pleasure to be here with Ben. And Ben, I just start off our conversation by asking you a few questions. It's great to be on your board. I've worked with you for years now, but this has been a different time in our relationship, and one where it's been fun to watch how you and the team have stared down something that's really a challenge to so many startup companies and early stage companies, and found opportunity to really engage more deeply with your clients and their patients. I mean, you guys have built this platform that automates and personalizes care navigation, and for patients as they're engaging with large health systems. And you did this, what I think was an unprecedented thing by bringing and offering to launch a COVID-19 program free to reduce barriers for your clients to bring these tools to improve how they engage and outreach with patients. Tell us a little bit more about how you and the team came up with that idea and decided to make this available in this way to your clients.
Sure. Thanks, Rob, and I appreciate that. Our team is a very mission-driven organization, and one of our core values is to serve. And ultimately, we started engaging our clients in how they were readying themselves for the oncoming COVID-19 pandemic. And it became quite apparent that we really needed to step in and help with not only our platform's capabilities to guide patients to services at a scale that we just had not encountered before, but also with the content that patients needed to be successful and understand how to navigate the COVID-19 pandemic in their local communities. And so as that evolved through conversations with our clients, we just understood what a unique position we were in with our clients to really deliver value to them and their patients that they were trying to serve rapidly. And we could turn this around in a number of days, not weeks. They had the motivation to make it happen for obvious reasons. And so we partnered with our clients, linked arms, and just tried to help them get the information their patients needed to be successful. We were just fortunate from a client perspective and a company perspective, given what's happening on the economic side of this, to really have this platform that truly helps and truly drives value in a matter of days. And we were able to show those results back to our clients with being able to get to almost 50% of their population with specific personalized care navigation plans for each patient, and teaching them about what services they were available to them and what information they needed in order to manage their own position in the population and community.
Yeah, that's amazing. Especially sort of it feels like the magnitude of that pivot was, or that the resource dedication it required to make that change was significant. Maybe tell us a little bit about how, where the company started and what you had built before this, what you were bringing to clients before this, and to put this pivot in context, and maybe in the process share a little bit about how you had engineered the platform to engage with patients, because that feels like what's the compelling hook right now on the service you're bringing to providers is that ability to engage deeply with folks who need information and are really longing for it.
Sure. So the platform itself uses analytics to identify what action the patient truly needs to take in a personalized way. We look at the patient-specific data. And when you talk about it from a COVID perspective, there are a number of risk factors that may mean COVID's going to treat or be more acute for an individual, whether that's age or condition, the chronic condition, pre-existing condition that they may have. And understanding that and using our platform to understand who each patient is and then automate the content and the guidance that that patient gets based on who they are as a person, it really enabled us to leverage the platform's capabilities of personalizing the information and the actions a patient needs to take in order to get the necessary care that they need. This is really no different, and I know we're using the word pivot, but to us, this really isn't a pivot at all. This is just what our platform is designed to do. It's just that at a much more robust scale than we were doing prior to this, given the urgency and need of information in a personalized way to each patient. And so prior to this, we were working with these same clients, but on other types of initiatives, making sure patients came back for necessary care on time, like annual wellness visits or care gaps, or making sure patients knew about immediate care options in their communities so they didn't have to go to the emergency room unnecessarily. So really identifying those types of actions for patients and then teaching them about how to use the other services that are available to them or how to come back for care to the right places. With COVID, it changed everything nearly overnight because those programs more or less stopped. Health systems were no longer really interested in trying to recall all their patients that needed necessary visits back to their practices because they needed to free up capacity to help manage and triage all of the patients in their community who were either going to be symptomatic or were currently symptomatic of COVID. So we were able to help them pivot on a dime away from some of those things that they were really focused on, and rightfully so, candidly, over to care traffic control, over to supporting the larger, more macro issue in their communities about helping patients get the information they need around COVID, if that makes sense.
Yeah, it does. I mean, still, I get how this is not a pivot for Upfront, but it certainly was a huge dedication of resource and a big lift for the team. And you did this during a period of time where your employees are shifting to remote work, and obviously lots of things going on in all of our employees' lives beyond the stress of the workplace. Talk a little bit about how challenging it was to drive this development program forward and how your team is doing as they sort of have had to balance all these different stressors in their lives.
That's a great question. And the reality is we're still right in the middle of it, Rob. We're scaling very quickly. We are continuing to engage hundreds of thousands of patients weekly to guide them to services they need and bringing more clients online. So I don't think that story is fully written quite yet about how we're managing through it, but I can tell you that this team is incredibly dedicated to this mission, and we are all working very, very hard to scale our platform to support our clients' needs to guide their patients to the services. And when we think about it, we think about our clients who are really on the front lines of healthcare, helping triage and guide patients to the services, and all of the things that they're struggling with on a day-to-day basis pales in comparison to what we're struggling with, trying to get our technology scaled out enough in order to support them. We view ourselves right now as the air cover for those front lines so that we can proactively engage the patients in their population, essentially to guide them and make sure that they're only utilizing the health system resources when they absolutely need them. Because we all know right now the issues with the availability of masks and swabs and just human resources, human capital to support the influx in certain communities of patients struggling with COVID.
Yeah, no, the challenges here are great, and as I've talked to caregivers on the front line or folks who are delivering solutions out to support them, one of the few things that's kept them going as they go through this sort of really intensive time period is just the feedback. The feedback loop is pretty short now, and figuring out if the solutions you're bringing or the care you're delivering is working and making a difference. And I'd be interested if you're hearing anything from your clients or the patients they serve about how your tools are being utilized or the impacts they're having on the population now.
Yeah, we are getting an awful lot of feedback, and that's heartening for all of us, and that's motivation for our team as well. And we get feedback from the client side of just how flexible our platform is to help them get to their patients in the way that they need to, and how we're bringing content to them. And I really think that the partnership element of the relationship as health systems and us are working closely together helps our team as much as it helps the client's team, just making sure we're in this together to help them solve the problems that they have around navigating their patients. The data that supports it are feedback we get from patients who are texting back through this digital platform we have, or commenting back to their health system about how appreciative they are about the health system being proactive in getting them the information they need, how cared for they feel by the system that's supporting them when they're proactively being engaged in a personalized way, as opposed to through some templated email or something of that nature that they might be more used to receiving in this particular instance. So it's heartening to us. And the data also underpinning what we're doing that supports it makes our team feel like we're really helping move the needle here to flatten the curve. And that's that we can get to 45% of the patients for a health system within a matter of days to help educate and guide them to the right setting of care for them based on who they are. And when you asked earlier about how it's impacting our business and scale, that's the scale that we're seeing now in the hundreds and hundreds of thousands. That is just really powerful and brings that energy back to our team and to our clients to let them know that that difference is being made.
Yeah, I can only imagine. I mean, it's one of the legacy challenges in healthcare and healthcare IT especially has been just takes so long to figure out if your solution is working or if it resonates or how to improve it. And I guess if nothing else, there's an opportunity now for companies like yours to discover more quickly what's working and what's not, and sense the impact that you're having and be able to adjust more quickly. And if there's a silver lining to this very, very large dark cloud, it probably is that these innovations are getting tested more quickly and in some cases getting deployed more efficiently to which hopefully will help the system overall. I mean, I'm on countless Zoom calls every day with entrepreneurs and other investors, and I'll say it is hard to overstate the amount of challenge that's facing the healthcare startup, early stage world. You've got basically a whole flock of black swans flying in from the slowdown from the end users and purchasers of these solutions, and that sort of the disruptions at the financial models of these businesses, and it's going to make it a lot harder for many of these companies to raise capital. There's a lot of entrepreneurs who are just feeling this pinch, and it's very real. I just got off a phone call with a number of investors, and many were comparing notes on how many layoffs each of their companies has had to have. And so this becomes real on a healthcare level. It's real for folks who are working out in this business and taking care of their families. And so it's heartening. It's heartening to see companies that have built solutions that, even though the initial use case may not be the one that's the hook right now, they've found a way to adapt what they're doing, adapt their solution, and go help on the front lines of how the health system scales to address what is a unprecedented problem. And I put up front, as I mentioned earlier, I put up front in a small group of the portfolio companies I have seen in our portfolio, or more broadly, who've been able to really find ways to lean into this crisis, to bring value, and to help people, and hopefully to help advance their business. And I'd say, as we look out at our portfolio, we use this as an example for many of our CEOs and many of our other portfolio companies, one of several, to say this is a way to, this is an example of how to lean into a crisis like this and how to hopefully create some of your own luck. And Ben, I guess I'd look, as you look around to your peers in the startup world, in the healthcare executive world, do you see similar trends? I mean, which are the business models or the partners or the other companies that are out there, that there are types of other companies that you see that may end up emerging out of this crisis stronger, and those where you feel, man, they may not weather the storm? Do you see any patterns in that?
It's tough to say right now. I was actually gearing up to ask you the very same question, Rob. But nationally, we're trying to triage our population because of the worried well, because of the rates of people who are actually sick. And so it's highlighting this need for how we triage on a much more large scale than we have before. And so the chatbots and the digital health capabilities like telehealth or e-visits are obviously being put to the test right now in a very positive way to help extend the health system's reach and to enable them to triage all the patients that they're supporting. So in some form or fashion, those were here beforehand. Those will be a stronger player in the market after. To what extent, I'm still not sure, because this is a very extenuating circumstance of a triage need in the marketplace to get patients to the services that they need and understand what their care is. So those, I think, are pretty clearly in line to have a big role going forward, as they did beforehand, but perhaps a bigger one. As we go from where we are right now and we head towards hopefully very soon flattening that curve and needing to not only triage these patients, but how do we navigate and follow them once that the care has been delivered and hopefully they have returned home and are well. But there's still a follow-up need to support those patients and to continue to support them going forward. So I'm interested to hear your perspective on where does it go from that triage and virtual care need once we move into the next phase of COVID?
Yeah, I know, it's interesting. I mean, I think in the history of my involvement in investing in healthcare, IT and healthcare services, there have been several transformative moments where business models have shifted, and it's embarrassing to acknowledge that most of those have been driven by reimbursement. This, I think, may be the first time in my career where we will likely see major changes in technology adoption, workflow, just the healthcare system's architecture that are driven less by reimbursement changes than they are by, optimizing the system to serve people better / public health priorities. And I'm optimistic that actually happens, because I think that would be good for the system, and would be good for sort of the innovators that we believe in. We're seeing across the portfolio, obviously, the adoption of virtual care, non-traditional care modalities, more convenient care modalities, to be honest, more consumer-centric care modalities, to be honest, accelerating at a rate they haven't accelerated despite all the lip service and hype over the years. So that's heartening to me that the systemic transformation will continue and lead us to new business models that actually will serve us much better and likely cost a lot less than where you've come from. I don't know if you agree with that, Ben.
I do. I definitely agree with that. And I think it does move us towards a different definition of population health going forward as we look ahead and truly, how are you truly using your community services? How are you truly engaging all of the resources available to enable patients or people to be successful in their care at a lower cost, with efficiency underpinning the whole thing, given what we're seeing today?
Yeah, well, no, and I mean, and not to get philosophical on you, but if you think about how much we've talked about social determinants of health over the past couple of years, and there's nothing disparaging about the businesses that are going after the traditional models of that, but oftentimes it's been about a third-party relationship
Right.
Between a deliverer of a service and a population. And I think now it's becoming very clear to people is one of the, in this pandemic, every individual has a role to play. They are themselves a vector of social determinants. They are, by walking 6 feet away from somebody, by staying home from work, by changing the way they live, by making personal sacrifice, they can have a positive impact on the health of the population and the health of many individuals. That makes the value of some of these things much more real, I think, in a way that the theoretical discussions of the past have not. So not as an exception to or instead of, but as an and. I think personal responsibility and community responsibility, and then the ability to leverage the resources that are present in the community, therefore, is going to become much more part of the conversation going forward.
In order for that to occur, we have to give people the right information to enable them to understand what their role in that greater population is on an individualized basis. And so if we can help enable every person to know exactly what they're supposed to be doing, it will, at scale, it will also benefit the people around them, as you just pointed out.
Yeah, and Ben, that's a powerful statement, both the comment you made and just the way, what it says about your leadership and entrepreneurial sort of approach. I mean, so many founders, I can imagine if I had built a business with a hypothesis about what the market was going to look like, and I'd engineered it for this reimbursement angle or, sort of this niche, and the world shifts this way, it's often easy. I can totally understand how, like a deer in the headlights, I would feel staring down this kind of tidal wave coming at me. And what you just described is a way of thinking about innovation, the way to think about entrepreneurship is much more agile and dynamic. This world is, the healthcare market historically has been slow to change, and except when it changes quickly. And I think we're seeing a moment where that change may come more quickly, and some of the old ground rules may shift under our feet. And as I think about the entrepreneurs that will be successful going through that, it's the ones who can actually reimagine their value proposition as the market is dynamically emerging and evolving. And as you say, for Upfront, at the core of it, you all are personalizing this navigation, this engagement for the individual patient as they go through something that's very complicated, very complex, hard to access, hard to understand. And that challenge isn't changing. It's only getting more extreme, and your solution can adapt to fit that. I think as I think about entrepreneurs who will be successful coming through this, it's those that can think about their own business in that abstracted way and reimagine their value proposition and pivot accordingly to be able to capture opportunities. And those that have come in to solve either a small problem or go after a reimbursement loophole, they may be very unpleasantly surprised by what comes next.
Makes a lot of sense to me. As an entrepreneur, you always have to stay nimble and understand and listen to what the market is telling you. And in this particular case, the market is literally screaming at you. So hopefully most entrepreneurs can hear what this market is telling you and try and navigate your way through it. It's when there's more nuance in it, to me, that is actually more challenging than when something as macro like this is really coming to us and we're so naturally well prepared to support it. Now, I will state, though, having both of us being in this general space for as long as we have been, I have never seen health systems move this fast to make decisions and to activate services and resources to make things happen. And that is awfully heartening to see them and bow their necks and make things happen at a scale and a speed that candidly didn't know they were capable of doing. One more question for you before we wrap up, though. From a payer side, we talk about innovation and the change in how care is delivered and how patients can access care. Do you see payment changing for some of those different models of care delivery more rapidly now?
I think the health plans are still thinking a lot about how can their models evolve to address these evolving needs and the changes in the way that care will be delivered and care will be accessed. It is a very early game, right? And so I think the providers that are your clients are moving first because they have to. They have a crisis on their hands, and health plans are in a supporting role as these changes ripple out over the course of time, and the market, and service delivery changes, a new normal sets in for how care is accessed. Health plans will evolve with it. So I'm optimistic that change will come. I'm not sure it will come as fast as the service delivery has needed to evolve, but I think will be a fast follower.
That's great to hear.
Thank you again, Ben Albert and Rob Coppedge, so much for joining HealthChangers today and sharing how you're both responding to the coronavirus pandemic from your respective points of view. We really appreciate your time today.
Thanks, Leslie. Really appreciate you inviting me on. And Rob, it's always great to chat with you.
Absolutely. Thank you, Leslie. Really appreciate the opportunity to be with you. And Ben, we just continue to be appreciative for all you and your team are doing. It's great to spend time with you.
Thank you.
That was Rob Coppedge, the CEO of Echo Health Ventures, and Ben Albert, the co-founder of Upfront Healthcare. And that wraps up this episode of HealthChangers. You can find more HealthChangers episodes at cambiahealth.com. You can also follow us on Twitter at Cambia, CAMBIA. You can now find HealthChangers on all of your favorite platforms. Just search for HealthChangers on platforms like Apple Podcasts, Spotify, and iHeartRadio. Please subscribe and leave a review. Thank you for listening.